Hello, welcome back to my introduction about colic in elephants, and this is the third episode. I'm going to talk about the classification of colic, and the idea of the classification is based on the equine practice. So in horses, we classify the colic into four types based on the basic pathology. The first one is non-strangulation obstruction. This type of the pathology have the luminal obstruction without significant compromise in the circulation of the blood vessel. The second type of the colic is strangulation obstruction. Um, it's a partly or complete luminal obstruction with partial or complete compromise of the circulation of the blood vessel. And the third one is a non-strangulation of infarction. It doesn't have any physical obstruction of the luminal, but there is a compromise of the circulation of the blood vessel in the intestinal tissues. And the other type of the colic, for example, inflammation, infection, or ulceration. So we divide it into four types. So let's take a look of some example based on the location of the GI tract. The first type is non-strangulation obstruction. Based on my observation, so in the esophageal lesion, in the esophageal region, example of the diseases is the esophageal obstruction. For the stomach, like impaction, I do believe that it exists, but we still cannot diagnose it yet. For the small intestine, example is the enterolith or foreign body. I don't think the fecal ball will get stuck in the small intestine because the transit time for the small intestine is relatively quick. For the large intestine, this may be the most common location of the non-strangulation obstruction in elephant. Example of the diseases including constipation or the impaction of fecal content, foreign body. Remember, at the junction between the large colon and small colon, there is a bottleneck that the obstruction commonly happen in that area. The excessive gas buildup and accumulation of the gas also can cause the physiologic obstruction of the intestine. So this is the example of the non-strangulation obstruction. Let's move to the second type, the strangulation obstruction. So as far as I know, in horses for the esophagus region, so there's none. Stomach, none. In dog, I think you have gastric torsion and volvulus, but in large animal, this disease not exist. For the small intestine and large intestine is more direct location. Example of the disease at the small intestine including torsion and twist, intussusception, herniation of the small intestine into the segment, herniation of the intestinal segment into the defect mesentery or the mesenteric rent. For the large intestine, it's pretty much the same, but remember the large colon is freely moved around the abdomen, so it's subject to displacement, torsion of volvulus, or being wrapped around by the segment of the small intestine, or the herniation of the intestinal segment into the defect mesentery. These all created strangulation obstruction. Let's take a look at the example of the horses. So I have two videos. The first one is a demonstration of the impaction of the left ventral colon in horses. So now we view one from the back, and the accumulation of the fecal ball in the colon caused the luminal obstruction. And the second video is about the strangulation obstruction, is the over the left colon that wrapping around and twist and cause the compromise of the blood vessel in the segment that being torsion. So the difference between the non-strangulation and strangulation obstruction, I'll explain a little bit. So regarding with the non-strangulation obstruction, there will be could be intraluminal or extraluminal obstruction of the passage of the content. There will be some physiologic disturbance. Could be physiologic disturbance that cause a non-movement. there will be no major compromise of the large blood vessel. However, in the strangulation obstruction, the obstruction could be both intraluminal or extraluminal. For the intraluminal, example is the intussusception. So this figure is from Sri Lanka. It's elephant that cecum being intussuscepted into colon. If it's the extraluminal, example is the displacement of the intestinal segment. We call displacement, and that should also cause the obstruction of blood flow of that intestinal segment. So this article talking about the strangulation obstruction in 4 cases. The first case is a 5-year-old Asian elephant and have a torsion of the mesenteric root of the small intestine. The second case is relatively pretty young, have the small intestine strangulated, small intestine wrapping around the last colon. And the third case is 4 years old Asian elephants have the distal small intestine incarcerated into the mesenteric defect. Mesentery have the defect and the small intestine go into the defect and cause strangulation obstruction. And the last case is African elephant. It have the 360-degree torsion of the mesenteric root of the last colon. So that's will be the two major types that I think is very important in elephants. And the third type of colic is the non-strangulation infarction. So this type of the colic is very important in horses in the past because it's caused by arthritis of the craniomesenteric arteries, and then in the artery from the thrombus, and the thrombus get loose to become emboli, and the emboli gets stuck in the blood vessel. But I don't think it exists in elephant, but we should know. Regarding with the location, esophagus none, stomach none, small intestine could be possible caused by the arthritis of the craniomesenteric artery by Strongyloides vulgaris. In the large intestine also the same. And for the elephant, I think this type of colic could be the secondary from prolonged distension of the loop. So for the other type of colic in elephant, I think esophagus could be esophagitis, could be primary or could be secondary. Primary could be burn from chemical. The secondary could be excessive distension of the gut or the stomach and then cause acid regurgitation. For the stomach, could be gastric ulceration, hemorrhagic gastritis, or secondary gastric distension. For the small intestine, could be proximal enteritis or gastroenteritis from infection or from chemicals. And for the large intestine, I think it's rare. So that will be my third episode. Hope you enjoy it.